I'm Kichu Nair. I'm Professor of Medicine at the University of Newcastle. I also work as a Senior Staff Specialist in Geriatric Medicine with the Hunter New England Area Health Service. This is a common question. Is driving challenging for older people? There are many reasons for this. Older people have many medical issues and physical issues. For many older people, it gives them independence and identity. They often restrict their driving according to their problems and the physical surrounds. If they lose their license, it is like losing their independence. And one of the patients told me, if they lose their license, it's almost like losing their leg. Older people may have minor accidents compared to the kilometers driven. They may have problems with their eyesight, have arthritis of the hands, or difficulty with turning the head around and neck because they may have some arthritis of the neck. They may also have some sensory and motor impairment. When you ask them directly, there are always the issues with reverse parking, parallel parking, sometimes small dents from small accidents, often reversing into a closed garage door, and similar issues. The other big issue is there are often some older people with undiagnosed or underdiagnosed dementia in the community. We know, for example, in Australia, between the onset of dementia and a proper diagnosis made by a specialist or an expert is at least 3 years. So there could be many undiagnosed people with dementia in the community. But I have to say, but most older people are fit to drive and no problem with their driving. They are insightful about their issues and drive accordingly. This is a common question asked. Should older people with dementia be driving? As we mentioned, in addition to the normal aging problems, people with dementia have more problems. The risks of accidents increases with the severity of dementia. The reasons for this are multiple. Apart from issues associated with normal aging, people with dementia may have other issues like speeding, running through red lights, not seeing pedestrians, difficulty in judging the distance from their vehicle to the other vehicles, and often not aware of their own behavior. They need all parts of their brain to work in conjunction to plan driving and do a proper, safe driving process. And we know that dementia can affect several parts of the brain. The other common issue is if they get lost, they get more confused and disoriented. So if an older person with dementia has an accident, and even if it's not their own fault, they can get into legal issues and insurance issues because they have dementia and they have been driving. So this is again a common issue. What are the issues with people with dementia driving and how can we deal with this? This is a huge social and emotive issue. There are moral and legal issues too. Most older people have been driving for 50 or 60 years without any incident. When they get dementia, they may lose their insight. The common argument we see is that they have been driving for 50 or 60 years without any accident. Why should they stop now? They think they'll lose their independence. Again, this is a major issue when they have poor public transport or they have no family support. So to deal with that, we need more patience. They should be treated with respect and say this is a professional advice, not just an opinion. Irrespective of the type of dementia, they are at increased risk. So we need to organize proper on-road driving assessment. This is the gold standard. We also know from evidence that memory scores have poor correlation with driving ability and safety. Then there are some screening tests, but again, they are not as good as the on-road testing because driving is done on the road. So office test cannot replace a proper driving test. So we could do a few things. Even if you advise and they agree, we know they might forget to do this or stop driving. So we should have some problem-solving strategies. Car is a visual trigger, so removing the car might help. Some families also disable the car or hide the key. What we have to underline is the safety is the main focus here. So what are the take-home messages from this? We know most older people are safe drivers and they restrict their driving. Dementia is a risk factor for accidents. Safety of the person and their families and the public is a key in any decision making about driving. Thank you very much for listening.